Hello, I'm Joanne Neves, and the paper I'll be discussing is the DSM is irrelevant to contemporary mental health nursing. What is the Diagnostic and Statistical Manual, and more recent, the DSM-5? The Diagnostic and Statistical Manual of Mental Disorders has been an important manual since it was released in 1952 and has been a valuable tool to those who diagnose and treat patients with mental illness throughout the years. It was brought about as psychiatry began to adopt the medical model. This paper will, however, consider the concept the DSM is irrelevant to contemporary mental health nursing and look at the evidence against this notion while discovering whether this is the case in today's nursing. How is a diagnosis determined? The subject of opinions, major diagnosis, and beliefs by clients. A person's diagnosis is determined on subjective opinions by psychiatrists rather than any medical investigation. And more often than not, a client will have numerous diagnoses, making it concerning as to the reliability of the diagnosis. Studies have found ranges of consistency for major diagnostic criteria broad in the early DSM manuals. On the most recent DSM-5, the outcomes were overall poor, with common diagnoses such as major depressive disorder having prominent levels of disagreement amongst the raters. This is a concern for those diagnosed with a mental health condition such as bipolar disorder, as this is a subjective opinion which is made into a firm diagnosis based on observation. This can make the person believe they have a long-term disorder with no remission out of the diagnosis and will act according to their belief. Nursing care today is to produce a formulation to complement a diagnosis which helps develop a relevant management plan. For many of us, the DSM is irrelevant to our nursing care provided to our clients, as we treat far more than just a diagnosis. This is made challenging as the medical model used in mental health remains dominant. As a mental health nurse, I believe the biopsychosocial model is more effective. The focus of the nursing care is to improve outcomes. Research shows that diagnostic-based interventions are unable to improve outcomes in clinical practice, while evidence-based interventions ensure that effective mental health care is provided. It is documented that evidence-based nursing care is evolving in mental health, with research findings making their way into practice and research evidence for mental health interventions increasing. Mental health nurses need to find a voice to challenge both established nursing practice and discourse on the socio-political context within which it takes place. It has been well documented that the use of psychiatric diagnosis, which is used within the medical model in mental health, increases stigma, limits decisions made, and is associated with worsening long-term prognosis for mental health problems, with the validity of the DSM remaining imperfect. However, some psychiatrists feel the importance of a diagnosis remains significant in how we communicate with our clients, making it key to ensuring clients make informed decisions about their care. Although mental health labelling can be helpful in assisting communication between professionals, it can be harmful when used by those who are unskilled in mental health. Sheff in 1966 hypothesized that social attitudes are negatively influenced by the presence of psychiatric labels, and that just the presence of these negative terms could cause patients to adopt problematic behaviour, thereby exacerbating social rejection. Psychiatric diagnosis within the medical setting can prove challenging to mental health workers. A recent experience was a call received from the inpatient ward to say my client had been admitted to hospital. She was 24 weeks pregnant with a history of medical complexities. She also had PTSD, anxiety, and depression. My client had been admitted to the maternity ward in which she was complaining of pain. Assessing my client, objectively there was no change in her mental state, and subjectively she stated her mood was good. It was the pain that was making her anxious and teary, along with being told by the inpatient team her pain was psychological. It was later found that day she had a kidney stone. This assumption seems to be a common occurrence with clients who have a diagnosed mental health condition. Other professionals tend to want to rule out psychological reasoning before doing medical interventions. It is vitally important for all staff to listen to a patient's concerns about their physical and mental health well-being, no matter what setting or ward they are in. With the push on mental health literacy on the rest of the world, mental health nurses need to work transculturally with culturally and linguistically diverse clients. We need to recognise the reciprocal influences of diverse cultures and work with a culturally sensitive and effective treatment and management plan for the client. We need to understand that cultural beliefs and practices can influence people's health and their behaviour, which can have an effect on how much they understand about their mental health. Conducting a cultural assessment can identify clients' beliefs, values and practices which relate to the problem and how they feel about the mental health service and treatment. DSM-5 is primarily related to psychopathology and mental illness. Clients may show subtle differences in their facial expression, body language and responses, but this may be distinct to the language used within their culture. It may be the way that best describes how they are feeling and thinking, and not have any psychopathology or require a mental health diagnosis. The risks of giving these diverse groups a diagnosis could have a significant impact on the threat to the existing cultural strategies that they may use for dealing with distress. They could also endure more, not less, stigma and may marginalise family and communities. The concept of mental health recovery is based on evidence that people with severe mental illness can live autonomous, contributing and satisfying lives in the community, even in the presence of persistent symptoms. Mental health nurses play a vital role in providing clients hope by being optimistic and positive in their recovery goals, which are critical for giving people with severe mental illnesses hope for their future. Having a diagnosis can hinder this process, as stigma still exists in the workplace, housing and other services. A study of interest which the World Health Organization carried out was on patients with schizophrenia. They found that after 2 years, around 2/3 of patients in less developed countries were doing well compared to only 1/3 of the patients in the developed countries. Researchers concluded that being in a developed country was a strong predictor of not attaining complete remission. This was found to be due to the medical model diagnostic approach being used, where having a diagnosis is perceived as having a condition which is lifelong in nature with limited expectations. To develop evidence-based mental health nursing practice, clinicians need to evaluate mental health nursing strategies, which will have positive outcomes for clients. This cannot be achieved through a medical model where clients feel they are stigmatized and end up with a lifelong dependency on psychiatric treatment. This reduces the chances of a good recovery, as their expectations will be one of a gloomy outlook. This must be done through a recovery model where our clients are the expert of their condition, and as professional nurses we must collect the information to enable us to help make informed decisions with the clients and others. It is time to move away from symptoms-based diagnosis. To do this, the National Institute of Mental Health is conducting research with a view of developing a new classification system for mental disorders based on genetics, imaging, cognitive science and other levels of information. Conclusion. Diagnosis is central to a psychiatric medical model used within mental health. We have seen how a diagnosis could hinder a person's recovery and need to consider in the future people may be less reluctant to go to community mental health services for the fear of having a diagnosis attached to them and seek help from their general practitioner or other specialist services. As mental health nurses, we can help ensure the clients we work with do not feel stigmatized, and by remaining positive in their goals and future can assist people to live their lives to their full potential. And these are the references I use throughout my work. Thank you for listening to my presentation.